Welcome to the Strokecast. A Generation X stroke survivor explores rehab, recovery, the frontiers of neuroscience, and how to peel a banana with one hand.
Hello, I'm Bill Monroe, and welcome to episode 54 of the Strokecast. This week, I want to share some news that came out at the recent International Stroke Conference in February of 2019. You can actually look up a lot of that information on Twitter by searching for the hashtag ISC19. I'll get to that news in a moment. First, I want to tell you about another show that I was recently a guest on. I had the honor of appearing on Café de la Torre's The Inspire Café podcast. She started the podcast to understand sort of what makes a person resilient. She explains her motivation like this. She says, "I'm fascinated with the stories of human resiliency. What makes these people tick? What became their turnaround, aha moment, or the trigger that caused them to pivot, shift their thinking, and turn away from the dark moment and face the light? The idea of people actually putting into practice of making lemonade out of their lemons, turning a negative into a positive, is remarkable." This week, I talk with Kathy in detail about my stroke in general, and why I started this show. It's really the latest version of my origin story. I am truly humbled to be on Kathy's show, especially when I look at some of the other folks that she's interviewed and some of the struggles that they have had to overcome to create positive things out of adversity in their lives. So after you listen to the Strokecast, head on over to the Inspire Café in your favorite podcast app and listen to episode 69. Or you could just go to the show notes for this episode of Strokecast at strokecast.com/ISC19 to listen there or find links to the Inspire Café and the other topics I talk about this week. And speaking of the other stuff, neurologists, researchers, and other stroke professionals from around the world got to spend several days in tropical Hawaii in February to learn to more effectively treat and prevent strokes, and presumably to work on their tans and surfing skills in the off hours. A lot of research, reports, and news came out of the conference, or at least around it. So this week, I'm going to talk about 10 news items related to the International Stroke Conference from February 2019. This will just be an overview. The episode would have to be as long as the conference itself to cover these topics in depth, but if you'd like more details, be sure to check out the show notes at strokecast.com/ISC19 for links to the original articles. One final caveat I do want to make is that these research discussions include some treatment options. This is general information only. I am not a doctor, and this is not medical advice. Nobody should be taking medical advice from me. Before making any changes to your treatment plan or the execution of your treatment plan, please, please, please consult with your doctor or medical team. Here are the 10 topics that I'm going to talk about. A new report shows that the opioid epidemic is leading to more stroke. TPA may be effective up to 9 hours after stroke. Thrombectomy can still be effective even if a patient has to change hospitals. Home-based virtual rehab may be as effective as clinic-based rehab. Silestazole combined with Plavix helps to prevent stroke. Flu-like symptoms may be a precursor to stroke. E-cigarettes lead to stroke. Marijuana and cocaine may be to blame for increased stroke in young people. Counties with dirty air have more stroke deaths. And fluctuating blood pressure after stroke is linked to death. So let's get into it. To begin with, a new report posted at the American Heart Association website shows that the opioid epidemic is leading to more stroke. The headline for this article says, "Opioid Epidemic Fueling a Rise in Infection-Related Stroke." And the article goes on to call out these highlights. The opioid epidemic is fueling a steep rise in infection-related stroke hospitalizations. Injecting opioids such as heroin can introduce bacteria into the body, which travels through the bloodstream to infect heart valves, Clumps of infected tissue can break off and travel to the brain, resulting in stroke. The report is important in that it does highlight an actual problem. The opioid crisis is a major problem in the United States. Folks who use heroin and improperly use other opioids set themselves and their families up for all sorts of problems. But it's important to look at the details. Most folks in local media will probably just glance at the headline and assume that opioids cause stroke. And that may improperly inform what they ask the government to do in regulating these medicines. When I read the article in detail, though, it's pretty clear that opioids don't cause stroke in this study. It's the bacteria that enter the bloodstream when an addict injects the opioid that causes the damage that leads to stroke. It's not the drug itself, it's poor injection hygiene. And that really needs to change the conversation. The problem with changing the regulatory framework around opioids other than heroin is that there are people who legitimately need these medicines. Many of them are stroke survivors living with chronic pain. And when someone's life is already afflicted with chronic pain, is it fair to make it harder for them to get the partial relief that these medicines can provide? This also brings up the question that some communities are struggling with around things like needle exchange and safe injection sites. Things like that could reduce the incidence of stroke by stopping the infections before they start. But whether that's the right thing to do is something that many communities are still figuring out. But it's important when listening to research and news reports about topics like this to make sure that you do look at the details to understand exactly what's going on there. Number 2, Neurology Today reports on the Extend study. TPA is something we talk about a lot on this show. It's the clot buster medication that can be used to treat ischemic strokes, clot-based strokes, if it's administered within 3 to 4.5 hours of the onset of symptoms. It can make a huge difference to patient outcome, but that window is tight. It's one reason I was not able to have that treatment. The Extend study showed that it might be possible to double that window to 9 hours of eligibility in some cases. The article says, in the primary outcome measure, 37% of patients treated with TPA in the 9-hour window, including those with so-called wake-up strokes, achieved a modified Rankin scale MRS score of 0 to 1 at 90 days, compared with 29% of the patients who were treated with placebo in the Extending the Time for Thrombolysis and Emergency Neurological Deficits Extend trial. P equals 0.045, said Henry Ma, MD, PhD, Director of Physician Training at Monash University in Melbourne, Australia. In the secondary outcome measures, achieving an MRS score of 0 to 2 at 90 days, the milestone was achieved by 51% of the patients treated with TPA, compared with 43% of patients on placebo therapy. P equals 0.022, Dr. Ma said in his late breaker oral presentation. So this is good news for those who acquire an ischemic stroke in the future. It could potentially significantly reduce the severity and number of disabilities that folks develop because they can get this medication in a larger window. Number 3, Medscape reported on the Diffuse 3 study and said, the new subgroup analysis found that for patients who were transferred from primary stroke centers and for those who were taken directly to the thrombectomy-capable center, rates of functional independence were similar, as were thrombectomy outcomes and rates of symptomatic intracranial hemorrhage and mortality. The Diffuse 3 trial, published last year, showed that endovascular thrombectomy was beneficial up to 16 hours after last known well time for patients thought to have salvageable brain tissue on perfusion imaging. Thrombectomy is a procedure where surgeons insert a catheter through the groin, up into the brain, and then drag a clot out to remove it. It requires special training, and not all hospitals are able to do it. Further, even in many hospitals that can do it, they may not have it available 24/7. This study means that if a patient goes to a hospital without thrombectomy capability, they can potentially be transferred to a different hospital to get the treatment and still get great results despite the delay. So this is another important study about showing how the window to treat stroke patients with different methods is growing, giving physicians more options to help prevent those disabilities and those deficits that so many stroke survivors have to struggle with. So let's move on to the fourth piece of research I wanted to talk about. And that's an article from Neurology Today that reports that home-based telerehabilitation for stroke patients is as effective as the clinic. The article says, telerehabilitation for stroke patients appears to work as well as going to a clinic for treatment. Research is suggested here at the 2019 International Stroke Conference sponsored by the American Stroke Association. In our presentation, we showed that telerehabilitation is non-inferior to in-clinic rehabilitation and improves arm motor status, said Stephen C. Kramer, MD, FAAN, professor of neurology, anatomy, and neurobiology, and professor of physical medicine and rehabilitation at the University of California, Irvine. This is important because not every survivor can get outpatient rehab due to everything from transportation to their deficits, the cost, the availability of services, and more. A good tele-rehab program where the therapist connects with the patient over a computer and camera or other setup can increase access to PT and OT and speech, especially for folks who might not be able to get it otherwise. It can also offer more career options for therapists who could theoretically run sessions from anywhere in the world for patients anywhere in the world. Another Neurology Today article leads with the headline, Xylostazol prevents recurrent strokes in Japanese study. The article says, dual antiplatelet therapy that includes xylostazol appears to reduce strokes in patients who have had a previous stroke and are at high risk of experiencing another, researchers reported at the 2019 International Stroke Conference. In a late-breaker presentation, Kazunori Toyoda, MD, PhD, Deputy Director of the Hospital of the National Cerebral and Cardiovascular Center in Suita, Osaka, Japan, said that the combination of xylostazol plus either aspirin or clopidogrel was superior in preventing another stroke than either clopidogrel or aspirin alone. Clopidogrel, of course, is more commonly known as Plavix. It's the actual name for the drug as opposed to the brand name. And it's a medication that many stroke survivors like myself are taking on a daily basis and will probably have to take for the rest of our lives. If there is a low side effect way to make it more effective and reduce the likelihood of a second or third or fourth or fifth stroke, that's great news. And it's always promising to see more of these combinations and these benefits coming out that our doctors can take advantage of to treat us even more effectively. Medscape also posted an article with the headline, Flu-like illness linked to stroke, cervical dissection. The article goes on to say, having an influenza-like illness, ILI, is associated with an increased risk of ischemic stroke on the order of 40%, regardless of sex, race, or geographical setting, new research suggests. The study shows that influenza-like illness increases the risk of stroke, particularly in the first 30 days, says author Amelia Boehm, PhD, Assistant Professor, Epidemiology, Neurology, Columbia University, New York City, told Medscape Medical News. I love these citations. This is another article where the details matter. It specifies flu-like symptoms, not flu itself. It also doesn't say those symptoms cause stroke, just that they are often present. More research is going to need to be done to look at things like causality and how all of this ties together and just what that mechanism is. What it seems we can do with this data in the meantime is to take reasonable steps to prevent flu-like symptoms. Wash your hands, drink plenty of water, get a flu shot if your doctor recommends it, eat well, the stuff we ought to be doing anyway to just stay healthy. This report really just gives us another reason to stay healthy. If it can help us prevent another stroke, that is awesome. Another American Heart Association article reports that e-cigarettes are linked to an increase in stroke. Yup, that's research. As Captain Renault says to Rick in Casablanca, I'm shocked to find that gambling is going on in here. The article says, study results showed a 71% higher risk of experiencing a stroke, a 59% higher risk for an MI, and a 40% higher risk for angina or coronary heart disease for the e-cigarette users compared with non-users. Users also had twice the rate of smoking regular cigarettes. Seriously, is anyone who is not a part of the e-cig industry shocked or surprised by this? Of course these things are bad for us. I'm not criticizing the study when I say this, because we do actually need the evidence to make appropriate policy decisions. But I don't think anyone is surprised by these results. E-cigarettes, vaping, it's bad for your health. Shocking. A different article, also from the American Heart Association, leads with the headline, Marijuana, cocaine, could play role in stroke increase among young adults. The article talks about the increase in stroke in younger folks. It says, the vast majority of strokes occur in people over 65, but the number of younger adults having strokes is rising. New research suggests growth in illegal drug use could be playing a role. Past research has shown higher cardiovascular death rates for young adults who used cocaine or marijuana. But the new study, presented this week at the American Stroke Association's International Stroke Conference in Honolulu, investigates trends in illegal drug use among 18 to 54-year-olds who had a stroke. Researchers looked at 20 years of drug tests and self-reported data involving more than 2,200 young adults who had a stroke in Greater Cincinnati and Northern Kentucky. While alcohol and cigarette use in the stroke victims remained stable over the 2-decade study period, drug use rose dramatically, from 4.4% in 1993 to 1994 to 30.3% in 2015. Now, the article caveats things pretty well. Since marijuana use is mainly self-reported in the study, the increase could be associated with people more freely admitting to its use as it has become more widely accepted and quasi-legal. What I didn't see in the article was a discussion of the delivery mechanism. In looking at the impact of marijuana use, it seems like the question of smoking versus edible consumption could be really important in evaluating the health risks. If the increase in stroke comes from smoking only, that gives us important information as we look at how marijuana can fit safely into people's lives. In another American Heart Association article, we learn counties with dirtier air have more stroke deaths. The article says, in a nationwide study, counties with dirtier air had higher rates of stroke deaths and shorter life expectancy, according to preliminary research to be presented in Honolulu at the American Stroke Association's International Stroke Conference 2019, a world premiere meeting for researchers and clinicians dedicated to the science and treatment of cerebrovascular disease. Researchers examined the average yearly levels air pollution, PM 2.5, that contain fine inhalable particles. Produced by diesel engines and the burning of coal, biomass, and kerosene, this type of air pollution has previously been shown to enter the circulatory system and harm health. Now, you see, when we have broader national and local discussions about the environment, about EPA regulations, the Clean Air Act, and the consumption of fossil fuels, we have to keep in mind that we are not just talking about helping our communities smell good or have clear skies. It's about people having strokes and dying. Folks can argue about global climate change, its impact on weather today, impacts on sea levels and acidity in the future, and all the other things that seem abstract at times. But putting those pollutants into the air today affects folks in those communities today. Finally, another article from the American Heart Association says fluctuating blood pressure after stroke could mean higher risk of death. The article states, a new study presented this week at the American Stroke Association's International Stroke Conference in Honolulu delved deeper into the topic by researching whether increased blood pressure variability after a stroke is associated with risk of death. Researchers looked at data from 1,947 patients who had 4 to 5 blood pressure readings in the 24 hours after a stroke. After adjusting for various factors, they found that patients with more variation in their systolic blood pressure, the top number in the measurement, had higher risk of death within 90 days. This research can inform hospitals as they figure out the best way to treat a patient experiencing a stroke. Do you drive blood pressure down to reduce stress on the vessels? Do you raise it to increase perfusion and blood flow after a clot clears? Do you then reduce it to prevent hemorrhage? I find this interesting because there are so many options that may seem right, and the more research we have to demonstrate the most effective ways to treat people and the things we have to prioritize in treatment, well, the better. So that's a lot of research, and that brings us to our hack of the week. On the rare occasion that I really clean the living room, I still tend to find random pills under the couch. They seem to get there after making a run for it as I move them from prescription bottles to my weekly pill organizers. Bowl cozies solve this problem for me. A bowl cozy is a curved, bowl-shaped quilted piece of fabric. Their main use is for when you're eating soup. You put your hot bowl of soup in it, and then you can pick up the whole thing without burning your hands. You can find them on Amazon, on Etsy. You can also find them at street fairs around the country, which is where my girlfriend and I got our bowl cozies. You can also find the patterns online, so you can go ahead and make your own. So how does this help with pills? We see now when I fill my pill organizer, I start by pouring pills into a bowl cozy. Then I can put them into the organizer chambers one by one. Then I put the leftover pills back into the bottle, and I moved on to the next medication. By using the bowl cozy to keep them contained and to keep them from rolling all over the place, I don't lose my pills anymore. So that's it for this week. I hope you find the science as fascinating as I do, or at least have new questions that you can raise with folks in your stroke community. I'd encourage you to read the articles yourself and form your own analysis. You can find them all over at strokecast.com/ISC19. So what do you think about this type of discussion? Let me know in the comments over at strokecast.com/ISC19. If you find this interesting, be sure to subscribe to Strokecast for free in your favorite podcast app. And of course, as always, don't get best, get better. Thanks a lot. I'm Bill Monroe, and I'll talk to you next week.
The Strokecast, Bill Monroe, and Bill's guests provide general information and entertainment, not medical advice. Please do not make any changes to your treatment plan or the execution of your treatment plan without first consulting your personal doctor or medical team. The Strokecast is a proud production of the Currently Speaking Podcast Network.